Welcome to the Back in Action podcast, where you're going to hear from me, a spine physician, Dr. John Lavelle, and two coaches, Dusty Holden and Josh Bunch. We're going to help you rethink pain, rebuild strength, and regain function so you can get back to enjoying the things you love in life without limits.
Welcome to Back in Action. Josh here with Coach Dusty. Dusty, welcome.
Hey, man.
Also joining us once again,
Yes.
Dr. Lavelle. It's great
Back
to see
at
you.
it. Good to be here.
Yep, once again, we're going to call an audible today, gentlemen. If you're at home and you're watching or you're listening, it may be important to reiterate some of the topics that we've went over. Episode 2 on fear.
Yep.
Episode 3 on back, or on pain, and specifically related to back pain. And some of the things that we're thinking about there is we're probably never going to be finished talking about those two things. So I think it's important if we recap. And maybe we go over some lost questions. Maybe we just didn't tag into all of it because there's so much material and it continues to change. So I figured we'd start there, kind of hit some points. And if you guys have anything else you want to bring up and to go into that.
I think there's so much in those two episodes that kind of tying it together. What's kind of the take-home points, action points? What can people do with that information? If they get injured, they get hurt, or they've been hurt for a while, how can they wrap that all together? Pain, fear, and control their symptoms on their own, or when to seek help and things like that.
Well, you mentioned that getting over fear was the most important step. So that isn't even talking about curing the pain. You said that getting over fear is the more important step. How do I know when whatever I'm feeling is, fear of just leftover noise?
For sure.
Fear because I'm pushing in too much.
Yeah.
And then the difference of how do I get through all of that and when to challenge it.
Yeah, it's true. And I think that, and it can be different levels. You could have had that usually there's an initial injury. I mean, whether it's just bending over and lifting something up, or it's getting tackled or hit or falling, there's an inciting incident that causes it. It might be very minimal, like reaching for something. So right away, it depends how you attack that. So is that pain been lingering for months now, where the initial inflammation or trauma that happened, ligament strain, muscle strain, the whole gamut of things that could happen to cause that initial pain to produce, has that completely settled down, but you're still fearful of that occurring? Or is it still acute? It happened 2 days ago and it was miserable and you just don't think you can move because you fear that you're going to damage something further. So it just depends when that patient or athlete is coming in. Where are they in that kind of continuum of their care? So have they had that initial injury kind of evaluated, diagnosed, and has that been fixed? And are you still having that pain sensitization? Is it still lingering in your mind that if I do something, that's going to come back? Or is it an acute thing where you just think you're going to keep making it worse? So that's where what we've talked about a ton, that initial person, clinician, coach, or family member you see, have they reinforced that fear not to move, or have you addressed that initial injury? So
Dusty,
it's not an easy answer.
With hearing about that and then the movement pattern wise, like when you take that acute piece versus that chronic piece, and I don't think we did that's great that you brought that up. I don't think we really detailed that out. Like the difference of acute pain, something that may have happened yesterday, and the difference of acute pain, something that may have happened 6 months ago.
Yeah.
How do you work with that in relationship to the athlete that's coming to you? So I call you today and I'm like, dude, my shoulder hurt yesterday. Or I'm like, my shoulder has been hurting for 4 months. What's the difference of treatment or the difference of the exercises or the movements, being a movement expert, or is it the same thing?
No, because I think they're different. So somebody that's maybe had shoulder pain for 6 months, I'm going to dig more into like the lifestyle.
Okay.
It being more lifestyle related, and maybe even that being the root, of what's going on. So movement is a big piece, but it's also, let's even dive deeper into it could be just something repetitive that they're doing, every single day. It could be, and normally is, like a combination of a lot of different things. There's repetitive movement. There's no specific or consistent exercise.
Activity.
It could be nutrition. There's all these different, again, lifestyle factors that could be just contributing to this ongoing, lingering, pain that they're
So
having.
you get a big history of this person. Okay.
Yeah, and those, those are fun because you're peeling back the layers and you're unlocking something. It could have been, 20, 30, 40 years that they've just been kind of feeling this way and have just grown to accept it. And for whatever reason, now they're just over it versus, the other and somebody that just hurt their shoulder yesterday. That one, I feel like you're more at the beginning stages. Let's get things to calm down first before we really start.
Dr. LaBelle, what do you see more of? So on any given time, do you see more, I just hurt myself, or do you see more, man, this has really been hurting? And I know you've said it in the past, a lot of times it might be the last case, but do you think it really is like they've been dealing with this for months and months, or is it just last week?
I'd say it definitely leans towards the more, it's been going on a few months.
Okay.
And then they're seeking that help, which I wish we could switch that continuum, because if we could see them early or get the right care early, treat the underlying injury or problem, truly give them that, I want to say diagnosis, but sometimes when you fall into that, I almost feel like we overdiagnose, where we want to give them A, B, and C. Part of that's insurance driven. They need to know it's a disc herniation, it's facet arthritis, it's a tear, it's a rupture. And that all instills that kind of fear. So it's good to do. You also don't want to just say, we're going to treat your symptom of back pain. So that's where it gets kind of complicated. We want to get to the root cause, but also not be fearful that I have this injury, it's never going to heal, and then it becomes chronic. So kind of get into that. If they could see someone initially, get that idea or true education of what's wrong, and then get them on the right path moving forward, treat that initially, and then you're going to prevent that fear long term.
That's what I was getting at. So I think a lot of the prevailing wisdom, or just some of the old holdovers, is ouch, it hurt yesterday, stop moving altogether. Mm-hmm. You're saying that it's the exact opposite of that. You would have rather gotten somebody day one, and then you would rather get them moving day one.
100%.
Okay.
Well, and I think that's one of the big benefits to when somebody gets moving. If they're coming from a background where they've had very little to no movement in their history, that it does take a little bit longer. But if it's an athlete, somebody who's been training, and now all of a sudden we've got like that shoulder issue, from an injury, but because there's already a base in place, we can get them back, on the field or back to doing whatever it is that they do a lot quicker, because they already have this prerequisite, strength and
if the foundation's better. So for our audience at home, if my foundation is better, I'm going to heal faster. If I'm a deconditioned athlete, it's going to probably take me longer.
Yeah, because we've got so much ground that we've got to kind of make up. Not only are we overcoming the fear of movement, but we've had really very little movement that's been ongoing in their life to that point. So we've got two big hurdles that we're overcoming, whereas the person that, at least has somewhat of a background, they know what it feels like to feel good. Yeah. And so they've at least been there. Yeah. And it gives them a little bit more of an incentive. And I think they're more open-minded, to moving. Yeah. When that's kind of the prescription, or that's the approach, versus the person that's like, maybe been told, hey, don't move, you need to rest. But if you've already been in that state, it's like, well, that's where I think it really goes south for folks.
Well, you're speaking a lot into the experiential stuff that we've talked about, and the way that my lifestyle frames how I feel, and that makes me think of, and I'm sure this is with a lot of athletes, and then this is with very different for maybe people that haven't made working out a lifestyle. How should I emotionally respond to injury? So I feel like a lot of athletes are doom and gloom, the world ending, and that's for not just athletes, but that's for just about everybody. As soon as I get hurt, I think life is over. In some way, life is changing. How do I emotionally respond to that, since that's connected with my recovery, to best benefit my future recovery?
Well, and you kind of just hit on it well, because initially when you get injured, have a trauma, that's your initial kind of, you look at those stages of grief, or I like to look at it a little differently than stages of grief, but stages of recovery from an injury. That initial one, you're going to have that shock and denial. Like, how did this happen to me? My life is over.
So these are sort of like that psychological stage. Okay, so
Exactly.
what would I need to be looking through, not just the body, so not talking about necessarily how tissue heals, but what am I going to go through then in my mind as I'm starting to heal? Like, what's the appropriate response?
So to be shocked and upset.
Okay,
You
so
can
you're
have
allowed
that,
to be pissed off that you're hurt.
Yeah, of course, and you're
Okay.
going to be. If you're an athlete or you're just a grandma, you're like, well, this is my golden ages. If you're older, like, I'm supposed to enjoy this, and that'll happen day one, and it varies obviously for everyone, these psychological stages. But it's normal to have these kind of social behavioral thoughts, and if we can attack that initially. So let's say you initially get injured. For example, yesterday, 2 days ago, I got a call from a tennis coach in town. His wife her arm got pulled. She was having severe 10 out of 10 shoulder pain. Called me on the phone, and I just kind of talked her down. I said, can you move your shoulder? No, because of the pain, but everything felt structurally okay, but just miserable. Hadn't had any pain. She was an active woman, not necessarily exercising a ton, but she was super scared. She was shocked. How did this happen to me? And almost getting in that denial. And then the next stage is kind of that anger and frustration. Like, what am I going to do now? Gets upset over it. But just kind of talked her down. I said, well, you don't need to see me today. It was the end of the day anyway. Just move it a little bit. I'll see you tomorrow. We'll see how you're at. She just did a little movement that just kind of calmed her down. And I saw her yesterday, which is only 2 days after the injury, and she was 50% better. Well, this isn't going to happen to everyone.
Sure, but that's important
that
to know.
reassurance and just knowing she could move it a little bit helped decrease the inflammatory response, the stress response. And so she was already feeling a little better. So when she came to me, she didn't want an injection. I didn't even do an x-ray because she strained her bicipital tendon just from being pulled like that. It was tender right over the tendon, and she was already getting better. So we're just going to do a little rehab. Now this is day 2, getting her moving right away. And I said, call me in 2 weeks. You don't have to come back and see me. Again, we don't need to just constantly see people and delay things. Get an MRI. That's 2 weeks later of not moving before PT. Let's do that first, because the MRI is going to confirm what I think is going on. Now, if this stuff doesn't work, then maybe we got to evaluate. Maybe there's a more major tear, but she didn't have a tear. Her biceps was moving, so you didn't need all this other nonsense. There's an art of medicine. We learn how to use our hands and diagnose and have a conversation. We shouldn't have to waste healthcare dollars and patients' time of recovery to do all this stuff.
Ooh, well, that's very true. And you said something that I think more people, we talked about education the first time and how important that was, but I think that's an important thing to reiterate what you just said, that she had an issue and it was immediately a 10 out of 10.
Yeah.
And can something be 10 out of 10 and then 2 days later be that much diminished, or is that our perception of the thing? Was it really the thing hurting?
It's really her brain hurting.
Her brain,
I mean, it is a 10 out of 10.
But she's making
Pain is
another.
real.
We all do this.
I think the key to that too is like she in that moment it was a 10 out of 10.
Yeah.
And this is like the worst thing
Because then you
could have
catastrophize
possibly
it
happened.
too.
That's right.
But then
that's
in the
exactly
way
right.
that you handled the conversation and you listened, basically validated, like, hey, I get it, like this hurts, but can you do this? And so you were basically looking for anything positive that
Exactly.
you could show her that's like, hey, listen, your arm's not going to fall off.
Right.
That's the first good news, And so with every little positive nugget that you found, then that lowered that anxiety
100%.
and everything that she was feeling. And you, at the end, give her the confidence to like, hey, you don't need to come in. You don't need to run to the emergency
that's
room,
Like those first few psychological stages, you have that shock and denial, you got that anger and frustration, and then the third one, and I use these kind of 6 stages, but that third one is depression, so an isolation. So we want to prevent that in that acute phase, because if it gets there, that's really when that the stress and all those things we've talked about over the last 2 podcasts with the neurological response, where it can start to become more a neurological issue and then a true injury, that's when that starts to get harder and harder to treat and prolong it. So if we can attack those first 3 phases initially with a simple phone call or a conversation and some simple education, we're going to get these injuries fixed a lot faster, whether it's the back, shoulder. Even if it is, let's say she did have a big rotator cuff tear, even if we start to treat that more quickly, or quicker, I should say, you're going to prevent those 3 first stages of grief or psychosocial issues that come up, and they're going to heal more efficiently.
Is this where can positive expectations enhance my recovery? Can that quicken that? So the way that you were talking a lot about falling into depression. So if the opposite of that was being optimistic about it. If we can
give some positivity to the situation.
But not fake. Like you're talking from experience. And we just said that Monday, the world was ending. Wednesday, I'm okay. I don't even need treatment per se.
Well, I think that's definitely true, inside the gym. Because really what we're looking for as coaches is anything positive that we can find in that, if it's the initial session. But really, every session. Yeah. It's like, what are the positives that we can take away? And to also be able to point out the improvement. It's like, hey, like yesterday when you were in, you could not get bend down to where your fingers were touching your knee. Now today you're, 4 inches below your knee. It's like just pointing those things out, because I think a lot of times people they're getting better, but they don't notice that they're getting better.
And so this in the respect to just to continue on to the shoulder, if I was to truly get an acute injury and it needed to die down. So in that application, I can't really move it much, although you said move it as much as possible, and that seemed to really help. But she would come to you that day. You would encourage that injury to come to you. You would do lunges. You would do squats. You would do all the other things to not necessarily attack it, but give wins that are outside of the box a little bit. So I'm not going to say, hey, we're gonna do snatches today.
Right.
We are going to adjust the workout, but those wins that come in the form of a lunge, a squat, or something else are going to aid in the recovery.
100%.
Okay.
Yep.
Okay. That's I think that's a big thing for athletes to remember, is that we can still go work out, that we have legs if the shoulders hurt, that we have arms if the legs are a little rough. There's some way to modify the workout.
Well, and where does there's a muscle in the back called the latissimus muscle, and it's all through the back, but it controls the shoulder extension and a little external rotation. So what is that? If you're doing lunges, you're doing squats, you're doing hip hinges, you're still activating the latissimus muscle, and that's attaching to the shoulder. Okay. So you're still treating the shoulder and muscles that attach there without actively irritating or making the pain worse in the shoulder.
And then we know that movement is also analgesic anyway. So the correct movement applied at the correct time and the correct dose will actually make the pain diminish, at least for a certain amount of time.
Yeah.
Which is why athletes often attribute the workout to making them feel better.
100%. Yeah. And I think there's always 2 parts to pain. There's the physical side of it, and there's the psychological. And so even if we're moving, we're making progress. No matter what the movement is, we're making progress in both areas.
What's harder?
Psychological.
Is it?
Yeah.
Okay. So I may or may not, we've established this, and again, watch our previous episodes, we've established this, I may or may not have a mechanistic injury, meaning images show nothing, but there's pain. Yeah. But you're saying that either way, it's going to be a psychological battle that's going to really get to the athlete. How have you overcome that or is there a specific method that works better than another?
Well, here's why I think that's the case. Google.
Okay.
I think because we have so much information and it's so easily accessible, the very first thing that people do is so you injure your arm, and probably before the phone call has been made to you, there's been a quick Google search to see exactly what this could potentially be. And there's a whole host of things, so
that immediately is instilling that fear.
So you've got fear, and it's just getting higher and higher the more the deeper that you go down the rabbit hole.
Let me interrupt you then. So if I hurt my shoulder tomorrow, should I just not research that? Would that?
No, I don't think that it's. I don't think that you shouldn't research. I think that there's benefits to that. I think you just shouldn't put all of your trust or all of your hope into whatever it is that you read, because it could be like very accurate, and it could be the furthest thing from like what you have going on.
That's what you were talking about, though, like our tendency to diagnose. But the tendency to diagnose comes from our want to be diagnosed.
Right. Yeah,
we want an immediate problem to fix.
It's a cause. I think that's just the world that we live in. There's there's a reason this happened. And so then when you don't maybe get the answer that you're looking for or that you want to hear, that sends you a little bit further, down the rabbit hole.
So what I hear is that it's a good idea to research, but I need to use that as one part. I could go ahead and research, that's fine. Then I need to talk to experts that know the body and that know movement.
Yeah.
Okay.
Yeah.
Okay.
And I think it's good to ask questions, when you, just like calling you and asking questions, you need to, the more resources that you have, I feel like the better your situation is. It's just, you have to ask yourself the question, is this, like the information that I'm hearing, is it encouraging me or is it discouraging me? If it's discouraging, I would question like the validity of it, because I think that you're going the opposite direction. In order to heal, you're going to have to be encouraged. So if you just continue getting more and more discouraged, that's where you've immediately got to slam on the brakes. And you've got to find hope. There's got to be hope in healing. And so that's where I think, when you're navigating through that process and when you're getting the information or the answers to the questions that you're asking, if it's everything is saying stop, don't do this, don't do that, then that's where you need to look in a different direction.
How do I shift after I've done that, after I've done some of the appropriate behavior about how I emotionally respond to it? How do I shift from protective to performance?
Well, I think that part comes with time.
Okay.
It's not something that it's not an immediate shift.
So let me show that I can deadlift 500 pounds. Great. I've tweaked my back, whatever that may be. Do I expect to come back to 500 pounds immediately upon the next workout? Are we looking at something that may be weeks and weeks away? Is it the appropriate framing of something that gets me to still perform, but changes me from protective?
Let me jump in for a sec. So we just talked about those first 3 stages of when you have an injury, that shock and denial, anger, frustration, and then you can fall into that kind of bargaining, depression, isolation phase. But then if we can move past that, it starts to become acceptance. So accepting where you're at. So you may not be able to do that. We'll switch from the shoulder to the low back, but that heavy deadlift right away. But you can start to accept, I tweaked my back, I strained it, I had a little disc bulge or irritation in there, and accept that is what it is. And then you can move on. So that acceptance is kind of stage 4, we'll say. And then 5 is starting to actively recover from that or start to move forward.
So at some point in time, I need to not deny. I need to not become
Something's
depressed about it.
Exactly.
There could be something.
And realize there's still some hope. There's accepting and, okay, I can do this. I can get back to where I was. And then that stage 5, starting to work towards that.
And then that could also be, if it's not mechanistic, though, I'm still accepting that I'm truly, for real, in pain.
For sure.
I'm not trying to dismiss the account.
If you have pain, something caused that pain.
Right.
So nothing's just truly in your head. Something happened. It could be minor, though. That's not a structural damage that you need surgery, an injection, or anything for. But something irritated that nervous system or those nerve endings to cause your brain to realize pain.
And the longer I do nothing, the worse that pain gets.
Because then it does become more in your brain, just constantly telling you something's there, even though it may have calmed down. So if we can get past those first 3 stages and had that education to know what's going on and accept it, and then you can move forward. So that stage 6 would be return to normal activity. So getting
Return
back
to
to that
sport.
500 deadlift.
Yeah.
But you got to do that rehab and that recovery in between.
And Dusty, the appropriate method would be to get there is you would challenge the movement pattern. Being a movement expert, you would do something like, well, we're going to see if we can maybe just cut the range of motion shy.
Sure. We're going to search for how can we perform the movement with less pain or no pain.
Okay.
And it could be adjusting just range of motion. It could be just that we go to another type of hip hinge. We're just not deadlifting from the ground.
So you de-threaten the movement.
Yes.
Okay.
Yeah, and so
Okay.
and then that again, we're working our way back to whatever it was that was the end goal. So if it's to get back to that 500-pound deadlift, well, now we're going to create a plan of this is how we're going to do it.
And there's not something that I necessarily did wrong. Like we may be able to
Could be.
retroactively, or in hindsight, I could say, man, you slept bad for 5 days. You did all these things. Sure, but maybe not.
Yeah.
Maybe
But
I can't find any of those things.
Those are all great questions to ask, though,
Yeah.
too. Especially, if you're deadlifting 500 pounds, like you've probably got a pretty extensive training background.
Yep.
You've performed quite a few reps. So, there could be something that's off technically, but I would say there's some other underlying issues. And when you start asking those questions,
You get to
you're probably going to uncover that, oh, yeah, well, I flew red eye back on Monday and, I've been traveling over
didn't
the
eat
last
so
3 weeks.
good.
Exactly. Like there's just things that are off. And those are normally that's where I would say, hey, if you are that person and you just flew red eye back from the West Coast, it's not a great idea to rush into the gym from the airport.
Max rep deadlift.
Exactly.
Right.
So,
Okay.
And maybe some of this too is, I'll take it to the other end of the spectrum, is maybe they can't do a 500-pound deadlift again. Maybe they did when they tweaked their back, have a disc herniation. Maybe it's not going to be the best idea to get back to the heavy deadlift, but reassess those goals. Maybe you don't need to max deadlift, still deadlift, but maybe what is your goal with that 500-pound deadlift?
Exactly.
Just to look good? Like maybe we reassess what our goals here for doing this stuff.
Yeah.
But
do
as
you
coaches, that opens up a whole other thing. So, okay, cool, 500-pound deadlift. Now we start to get into the asymmetries. What's your squat in relation to your deadlift?
Yeah.
Carl Miller, Olympic coach that defined a lot. What's your front squat in relation to your back squat?
Mm-hmm.
Maybe at this point in time, and I've had this come up. Well, tell me, what's your back squat? And then you have the athlete talking, they're in pain. And then what's your deadlift? And if those two don't have certain correlates, if those ratios don't match up, maybe the issue isn't the positioning, it's the asymmetry that comes up as you really like to deadlift and you really don't like to squat.
Yeah.
So we just do more of the other thing to get you back there. And that can be another way to enter into that, because we're never trying to amputate a movement from an athlete. We're trying to give them more movements or preserve the movements that they love to do the most.
Exactly. How
How do I measure this? This can be one of our last kind of takeaways, and I think we missed this in some of the other ones. How do I measure my progress if I'm still in pain? Because I don't want to make it seem like I'm not going to work out and immediately be out of pain. There's probably going to be a time where I've injured, be it acute or be it chronic, that I'm still feeling discomfort. How can I measure my progress, and how do I know what I'm doing is the right thing to do if I'm still hurting?
Well, I think the first thing is that are you back training? Are you back in the gym?
Do you mean, have I adjusted my training as it relates to my injury? Like I was working out 3 days a week, now I'm only doing one?
Well, it could be that you've adjusted. I would say that the big thing is like step one is we got to get you back doing the thing, like if back in the gym or back to performing,
Functioning.
Yeah, most of the like your daily things. And to me, training that's
a daily
It's
thing.
like getting up and brushing your teeth.
Yeah, that's right.
That's something that you do every day. You're training to be the best version of yourself. So it's like let's get you back doing those things. Okay,
So that's a good metric. Even if I'm in a little bit of pain,
Right.
that's okay.
And we just want to keep checking in on that.
It doesn't mean I'm doing something wrong
No.
if my low back still hurts as I'm getting there, but I'm getting more and more comfortable with the things. I'm just still in a little bit of pain. That's okay.
Yeah.
Okay.
Yeah,
How long will something like that last that you've seen? So I got an acute back injury versus a chronic back injury. What does that look like in terms of how it plays out in reality in the gym?
I think it varies, but I've seen somebody be in pain for 6 months and come into the gym 2 times and they're out of pain.
Okay,
But then I've seen people that they've been in pain for 3 or 4 years and it takes a couple weeks, 2 weeks, a couple months. I never like to talk about like how long is this going to take, because it's just hard to say,
It's very individualized.
Because there's so many other factors that play into it. I mean, I see you for 1 hour in the gym. Well, there's 23 other hours in that day that there's a lot of things that you're doing. So it depends on how dialed in that person is. Like, how committed are you to getting out of pain? And I think those are questions. It's like when somebody tells you it's a 9 out of 10, and then, well, here's the way I see this going. We need to see each other every day. Well, I can't do that. I can only see you once a week. Well, is it really a 9 out of 10?
That's good.
Or is this something that, like, just in your mind again, that you've hyped up to this really, really big deal, but when it comes down to it and the rubber meets the road, it's like, yeah, I'm in pain, but I'm not willing to do that every day to get out of pain. So then that's where I would ask the question, if it's really a 9 out of 10. Because for me, if it's a 9 out of 10,
I'll do it.
I'm going to be there.
100%.
I'll be there.
Right.
If it's an 8 out of 10,
100%.
And so, again, I think that's where it just comes back down to the whole approach and how you approach the training. It's like the training is a piece of what we do, but I feel like the psychological barriers that we sometimes have to overcome with injuries or chronic pain are so much greater and hold so much more merit in a person's life than the situation that they believe caused the issue to begin with.
So our goal is to get out of pain. We have that. But my measure on my way to get there might be how I view it, my perspective on it, but it might also be how I interact. Beforehand, I was scared to death to pick my kids up, but now all of a sudden, I know that there's a little bit of discomfort, but I'm not worried about that. That may be a huge metric. That might mean a lot more than just fitness.
Yeah.
And I'm just going to say 2 different cases to kind of explain this that I've had this week. One was a 66-year-old lady. One was a 55-year-old guy. The lady was both similar, a little overweight, not very active. They're older. The lady both had pain for, let's say, a month or 2. And it's been going on we're in beginning of June, since the springtime, beginning of spring. She comes to me. They both had MRIs already. Both have every diagnosis on the MRI, from disc bulges, stenosis, arthritis, muscle atrophy in the paraspinals, and decondition. Both have the same exact kind of thing going on. I told them the same thing. We don't need surgery right now. There's nothing that's going to magically fix right now. I don't even think an injection is going to cure you right now. They both had, let's say, 6 or 7 out of 10 pain. So good pain. They don't want to move. They're fearful.
Significant.
And I put her in a training program. She had a physical therapist that was very good at teaching movement, exercise, strength training, just like the 2 of you. She was doing that religiously 2-3 days a week, missed some sessions, but was doing that regularly. Only a month after, I usually see him 4 or 6 weeks after, she comes back, she's 75, 80% better. She's doing the things she want to do. Not pain-free, still not going to do an injection to get the next 20% because she's on the continuum of getting better. So we're going to just keep going with that. She's happy, she's excited. The other guy is a hotel maintenance guy, so like I said, a little overweight, same diagnosis. He comes back those 6 weeks later, just shows up, sits down. Why are you here? He's like, well, I'm here for an injection. We never talked about an injection that first visit. That was his expectation, that he needed something done. Well, we talked, and I look back at the note, we talked about getting movement, the reason for movement, getting you in with a good physical therapist. Well, I didn't want to do that. My life's too busy. I already figured, I push mow my half-acre lawn. That's once a week. That's not exercise.
Right.
And he works hotel maintenance, but he's just the head of it. So he's not doing the heavy lifting, bending. Even if he was, that's not true training. He was no better, if not a little bit worse. So he's just letting that instill, not following that same continuum the other woman did. And then he has all these other stressors, work's busy, things like that, but didn't want to follow that path that'll actually get him there through functioning to decrease that pain. He just wants that procedure. So we'll kind of talk about that over next episodes of when you do injections or procedures are necessary, because sometimes they are, but it's still in the end the same treatment thing. Even if we did an injection on someone that needs it, they still got to do all the other stuff. Because the injection's not curing anything. Surgery's not curing anything. You're still going to have pain. So how do we really get them out of pain, I think would be fun to talk about.
Two perfect stories that I think wrap that up well, that we can get into the next time.
For sure.
Of how one athlete and one perspective sets us up for success and then one doesn't.
So important.
Thank you, gentlemen.
Great time.
Thank you for watching. Join us for much more Where That Came From. And when you get a chance, follow us on Instagram and YouTube at Back in Action Podcast.